Hello, everyone. This presentation is meant to introduce the responsible innovation in health. I will describe a framework and a tool to assess the societal value of innovations at an early stage. So what I will do within the next 20 minutes is first to say a few words about the foundations of our research program. Then I will introduce the Responsible Innovation in Health, RIH Conceptual Framework. I will describe how my team developed the tool and how it should be applied. And I will conclude on the ways in which it may inform decisions. For the past 20 years, I've done research on new medical technologies, and I started by examining the use of technologies in a real-world context, utilization by physicians, nurses, but also by chronically ill patients. That work was closely linked to health technology assessment. Later on, I moved my research interest upstream. I've looked at business and venture capital dynamics in health technology development. So it's called upstream because it's before technologies make their way into healthcare systems. In 2015, we got funded by the Canadian Institutes of Health Research to begin a 7-year research program on how can RIH better meet the challenges of health systems. I do have the privilege to rely on several colleagues that include physicians, engineers, economists, and social scientists. We do empirical research in 3 regions, 2 Canadian provinces, Ontario and Quebec, and the state of Sao Paulo in Brazil. We draw heavily on the field called responsible research and innovation, which has gained traction in the European research policy landscape in the past 10 years. RRI draws attention to innovation's likely impact, but it also begs the question of why do we innovate? What are the purposes? So anchored into the 21st century challenges, the aim of RRI is to develop our collective capacity to steer the design of new technologies toward important societal challenges, and that includes sustainable development goals of the United Nations. For Stelgo and colleagues, responsible innovations means taking care of the future through collective stewardship of science and innovation in the present. And 4 processes have reached consensus in the literature. The first is to be able to anticipate the risks and consequences of innovation. The second is to be reflexive about the social norms and biases that sometimes underlie innovations. And for that, it is promoted to be very inclusive in the innovation development processes, including the publics, but also third parties who may be left aside too easily. The last principle, responsiveness, brings attention to whether we have the means to realign technological trajectories in due course if any emerging issues emerge. In the health sector, responsibility is already pretty much institutionalized because there are several professional groups who rely on codes of conduct. The regulation of new drugs and technologies is also well established, and most hospitals rely on quality insurance mechanisms. There is also a long tradition of research in bioethics and on the ethical, legal, and social issues of innovation. And as you know, there's a strong presence of health technology assessment. However, none of these mechanisms can inform early stage decisions. And today's innovation do exacerbate many of health system challenges. They will exacerbate service delivery challenges because innovations are often targeted at highly skilled providers, and these providers are only found in large urban centers. Innovation often also increase human resource challenges because they transform the nature and scope of their tasks and skills. And more complex technologies also call for more complex governance mechanisms for dissemination, use, and reimbursement. In our work, we wanted to ground the concepts into practice. That explains why we adopted an iterative approach. We started by creating an inventory of innovations that could be described as potentially responsible. We also completed a scoping review of health systems' needs and challenges and qualitative research with innovators. That was completed by reviewing several bodies of literature, which led to the conceptual framework, which was then translated into the RH assessment tool. So we came with the following definition. RIH consists of collaborative endeavor wherein stakeholders are committed on the one hand to clarify and on the other hand to meet a set of ethical, economic, social, environmental principles, values, and requirements. And these requirements apply when innovation stakeholders design, finance, produce, distribute, use, and discard socio-technical solutions. So we have all these verbs in order to capture all stakeholders involved throughout the innovation's life cycle. And the purpose is to address the needs and challenges of health systems in a sustainable way. The conceptual framework is comprised of 5 value domains and 9 attributes. So the first value domain, population health, has 3 attributes. So we ask, does the innovation address a relevant health problem? Was it developed by seeking to mitigate its LCs? In what ways does the innovation promote health equity? The next value domain, health system, also has 3 attributes. So we ask, were the innovation development processes inclusive? Does the innovation provide a responsive solution to a health system need or challenge that is seen as important in that region? Is the level of care required compatible with health system sustainability? The economic value domain is not per se about price or cost of technologies, but it brings our attention to the innovation production processes and design decision. So we ask, does the innovation apply a frugal approach to deliver greater value to more people by using fewer resources? The organizational value domain asks whether the business model of the organization that produces the innovation provide value not only to users and purchasers, but also to society. Lastly, the environmental value domain asks the question as to whether or not eco-responsible principles were applied throughout the innovation's life cycle. So this is a visual representation of the conceptual framework. It's 5 value domains and 9 attributes at the center. And I would like now to attract your attention to these 3 words, process, product, and organization, because they shape the way we define the attributes. The reasons why is because that processes alone are clearly not sufficient to lead to responsible products. Another issue is that innovations do not and cannot exist without an organization, and responsibility clearly depends upon the business model applied by this organization. To provide you with an example, there's a company that distributes pediatric hearing aids that were developed by using solar-powered rechargeable batteries. The project was co-designed in Botswana with users and local engineers. And because of their frugal innovation production processes, the device can be sold at 20% of the market cost. And because its mission is to break the circle of poverty in which deaf children are born, the company also hires people living with disabilities. And the environmental impact associated to rechargeable batteries are significant. In a nutshell, the RH tool can be said to be grounded in the healthcare sector philosophy, because it relies on an evidence-informed assessment process. We design 4-level scale that can be translated into a numerical score. There's no weighting of the attributes, meaning that all attributes are considered equally important. And the interpretation of the overall RH score will consider both the availability and the quality of the information sources. The first version of the tool benefited and was improved thanks to the comments of 4 groups of experts in RRI, biomedical engineering, bioethics, and HTA. So we achieved consensus after the second round on the majority of the items. And we knew that hard work was still required to get to the final version, but we received many positive comments. So the final version of the tool entails a three-step evaluation process. There are both inclusion and exclusion criteria, then follows the assessment of the 9 attributes I presented earlier, and there's a rating step. So the logic behind the four-level scale is to measure the degree of responsibility. And here it's important to underscore that a D doesn't mean that the innovation is irresponsible. It simply flags the fact that no particular signs of responsibility have been observed. Irresponsibility is dealt at the exclusion criteria stage. So the tool itself is an 8-page online supplement to a publication we published early last year. To provide you an example, this is the attribute inclusiveness. So we start with the definition and explain why this attribute is important. Then we describe what type of information to look for. And then we have a scale, 4-level scale, where each level is defined with a description to reduce subjectivity. We use a very simple classification system for the quality of the sources of information, ranging from type 1, low quality, that would apply to the technical documentation that the organization makes available. The second type 2, moderate quality, includes the gray literature that is issued by formal organizations. And type 3 includes high quality information sources such as peer-reviewed scientific articles, systematic reviews. So HTAs and Cochrane reviews would fit in that third category. This is a visual representation of the scorecard. The idea is that the tool should be applied in a transparent and accountable way. So this scorecard is available as an Excel spreadsheet, and we suggest that extract from sources of information be inserted in the scorecard to justify the score for each attribute. So first, the scorecard identifies whether the information was available. It establishes a mean score for the quality of the information sources, and then a mean score for the attributes themselves. So the overall RH score is interpreted according to 4 intervals. These 4 intervals follow the logic of the scale. And we also provide what I would describe as a very conservative interpretation rule, meaning that if 7 or more of the attributes are documented, and if the mean score for the quality of information is equal or superior to 2, then we will consider the score meaningful. So why this threshold is so conservative? Mainly because we wanted to attract the attention on the justification, the content in the scorecard, rather than the numerical score. So we measured the reliability of the final version of the tool. 2 raters applied the tool to 25 innovations, and we obtained complete agreement for 4 screening criteria, almost perfect agreement for 7 attributes, as well as for the RH overall score, and substantial agreement for 2 attributes. Therefore, it's important to pay attention to health inequalities and inclusiveness where there are some subtleties. We designed the tool to inform early stage decisions by innovators, investors, research funding agencies, and so on. So early years should be understood in relation to the transformational impact the tool may have over the innovation. So that would entail, for instance, redefining process, product, and/or organizational level characteristics. We see 2 different types of use. So the first is as a formal assessment tool, like I described so far. And here, the tool must be applied by people who hold research skills because it entails retrieving and summarizing scientific evidence. We also suggest that multidisciplinary team members apply the tool independently and then reach consensus through deliberation if any divergence is observed. But the tool may also be used as a design brief, because each attribute and level of the scales are described in a very tangible way, so that can inform design and financing decisions. We applied the tool within the context of a broader longitudinal case study, which began in 2015, and in which we follow small and medium-sized enterprises that are already engaged in the production of responsible innovation. These are located in Quebec, Ontario, and Sao Paulo. And to provide you examples, one company is developing affordable tablet-based hearing tests, and they do focus on hard-to-reach workplaces. Another one is selling eco-friendly drug packaging solutions for pharmacists and drug retailers. Another example would be the multi-dimensional intervention, which is targeted at improving the safety and work conditions of waste pickers. And that intervention include an app to connect people that have materials to recycle with waste pickers. Another example would be solutions combining robotics and AI-based components, which enable a person in a wheelchair to control that wheelchair through facial expressions. And on this slide, what you have are the findings of the application of the tool for the cohort as a whole. So first, it shows that 5 attributes were fulfilled by more than half of these organizations, and they obtained an A score, which showed the feasibility of fulfilling several attributes simultaneously. Also, it shows that more than half of the cohort obtained a C score on LCs and inclusiveness. This may highlight that some trade-offs have to be made between different attributes. Another point to which I would like to attract your attention is the fact that information about eco-responsibility was available only for 5 out of the 16 organizations. So the tool may also be used to signal the need for more research on the environmental impact of medical technologies. In the study we did with innovators, we observed that they do support several RIH dimensions, but they also call for policies and regulations that reward these features, in particular, eco-responsibility. These innovators were also critical of incentives that are misaligned in terms of the business model and health systems needs. So policymakers should seek to translate health system level demand into innovation development opportunities. So to conclude, I hope to have conveyed messages that RIH seeks to make health systems more equitable and sustainable. It also fosters entrepreneurial activities that provide more value to society. And in the long run, the uptake of the tool, we hope, could steer the supply of health innovations towards solutions that can help tackle important population health needs, as well as health inequalities, that can provide timely responses to systemic challenges, high-performing and affordable technologies, and also greener solutions. Thank you very much for your attention.